Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief IVF Consultant, Gynecologist and Laparoscopic Surgeon here from Vriksh Fertility, HSR Layout, Bengaluru. Usually a woman produces only one egg per month, and this egg is usually transported to the fallopian tube wherein it waits for the sperm to come and get fertilized into an embryo. This embryo is again transported into the uterus wherein it sits into the uterus cavity, gets implanted and then grows into a beautiful healthy baby. In IVF, the ovaries are stimulated to produce multiple follicles, multiple eggs. These eggs are usually collected from the ovary directly prior to ovulation, before the release of the egg itself, and it is fertilized in the laboratory with the husband's sperm, and these fertilized embryos are cultured for up to 3 to 5 days. So one or two of these embryos are transferred into the female partner's uterus via a thin embryo transfer catheter, and this procedure is called embryo transfer. So the couple's own egg and sperm can be used, or alternatively we can also use a donor egg or donor sperm depending on the diagnosis and the condition of the couple. So what are the steps involved in this IVF? Step number 1 is to evaluate the couple thoroughly. Not every couple who wants to plan pregnancy will have to go through this IVF procedure. We have to first evaluate and check both the male and the female partners in order to assess why they are not getting pregnant and what are the prior treatment history, medical history, surgical history, genetic history. And then we are going to do certain tests and investigations, and then we decide whether this couple is for IVF or not. Secondarily, if the couple is for IVF, so planning an individualized IVF stimulation protocol is very important. Thirdly, once we start the IVF procedure, usually we call the female partner around second or third day of her menstrual cycle. The fertility specialist usually does an ultrasound scan, and injections are advised depending on the scan, BMI and your other reports. So these medications which are advised, the tablets and the injections, are usually advised for about 8 to 10 days time in order to stimulate all the follicles which are present in the ovaries. So this growth of the follicles is tracked by serial ultrasound scans in between, and the dose of the medication which is advised is adjusted accordingly. So once the follicles are ready, we usually give a trigger injection, and within 36 hours or so we plan an egg pickup. So this egg pickup is usually done under short general anesthesia. It is absolutely painless and it is a daycare procedure, and what we do is it is done under ultrasound guidance. A needle aspiration via the vaginal route is done and eggs are collected. These eggs which we collect are nothing but they are the follicular fluid which is there inside the follicles. So collecting the eggs is done as a daycare procedure. It is done under short anesthesia and via needle aspiration through the vaginal route. So it is absolutely painless. There is no scar on the abdomen, or there is no inpatient admission required or anything like that. So the same day, even the male partner gives his semen sample, which we process, and good best sperms are selected for the IVF procedure. So the female eggs which are collected are fertilized by the male partner's sperms in the embryology laboratory by the senior embryologist. So these fertilized eggs are called as the embryos. These embryos are cultured for about 3 to 5 days in special incubators which are exactly maintained in conditions like our uterus. The same temperature, humidity, climate are exactly maintained the same. And then after 3 to 5 days, once the embryos are developed, we see which are the good embryos, and only those good embryos are either tested for genetic problems if it is advised by a doctor, or they are transferred into the uterus of the female partner if the uterus lining is good and if the hormones are also very good, or they are frozen and kept for future use or future embryo transfers later on. if you want to plan the pregnancy later. Or if you've got too many eggs and we do not want you to land into complications like OHSS or ovarian hyperstimulation syndrome, we usually advise to freeze all your embryos and keep. If everything looks good, then one or two of these good quality embryos are transferred into the female partner's uterus via a thin catheter through a procedure called embryo transfer. It is done under ultrasonography guidance and it is absolutely painless. Then support medications are given for about 15 days, and then once you miss your period, we will see you with good news of a positive urine pregnancy test.